We use chemotherapy to treat cancer, and the number one worry about chemotherapy treatment is hair loss. A study done a few years ago found that in over 1,400 breast cancer patients who had chemotherapy, 99.9% of patients lost their hair from their heads. And in 95% of patients, they lost more than 80% of hair. The thing is, you don't only lose hair from your head, you lose it from your eyebrows, eyelashes, your arms, legs, underarms, and even your pubic hair. The study found 59% of women lost more than 80% of their eyebrows, and 60% lost more than 80% of their eyelashes. At the end of the video, I will tell you what can be done to minimize hair loss. So why do you lose your hair after chemotherapy treatment? Hi, my name is Dr. Tasha and I'm a breast surgeon. So chemotherapy is a drug that is used to essentially kill cancer cells. And cancer cells are rogue cells that divide uncontrollably and grow in an abnormal way. Chemotherapy is a treatment that is given either through the veins or taken in tablet form. And the aim is to hunt down cancer cells and kill them. But how does chemotherapy do this? Well, cancer cells are cells that are dividing rapidly, and chemotherapy specifically seek out these types of cells. The trouble is, many cells in our body are also rapidly dividing, such as hair follicle cells. And so the chemotherapy drugs will also affect these cells too, killing them in the process. That's why hair falls out with chemotherapy. And this can affect hair anywhere in the body that grows hair. So can you predict when hair loss will happen? This actually varies from one person to the next. It can also depend on the type of chemotherapy drug you are having, as well as the timing of it. So if you're having chemotherapy weekly in smaller doses, this may minimize hair loss compared to if you are having it every 3 weeks at a higher dose. Now, hair loss may start to happen 2 to 4 weeks after you start your treatment. You may notice it come out in clumps on your pillow, in the shower, on your hairbrush, and your scalp may also feel a bit tender. Usually hair loss will continue to happen through treatment and a few weeks after. And you may also actually just get thinning of the hair if you don't go bald completely. Will my hair grow back? Most of the time, hair loss after chemotherapy is temporary and it will grow back. It may take a few weeks before the hair follicles fully recover and hair starts to grow again. Some people find that the texture and the color changes compared to before. It might be curlier or gray until the cells that control hair color begin to work again. However, for some people, the hair may be thinner with incomplete hair growth, and some may have permanent baldness and loss of eyebrows and eyelashes. So what can we do? Unfortunately, you can't stop hair loss from happening, but you can minimize the effect of chemotherapy. One of the ways that has been shown to help is by using a scalp cooling system. And the aim is to cool the scalp, which narrows the blood vessels beneath the skin of the scalp. This reduces the amount of chemo drug that reaches the hair follicles, so lessening the amount of damage. It involves wearing a tight-fitting helmet-like hat that is filled with either cold gel or liquid that is worn before, during, and after treatment. There are different types of cooling systems, and you can have a discussion with your doctor about it. Unfortunately, scalp cooling isn't tolerated by everybody. It can cause headaches, nausea, dizziness, and even scalp pain. There are things that we can do though to prepare for chemotherapy hair loss. Consider cutting your hair to make the transition less noticeable, particularly if you have long hair. The scalp can get a bit itchy and sensitive during treatment, and so many may consider shaving their heads completely to reduce the impacts of when hair starts to shed. And start looking for head coverings such as wigs or scarves. Now, of course, this is a personal choice. Some choose to cover their heads, whilst others prefer not to. Whatever you decide, planning ahead can be very useful. I hope this has been helpful. Take care, and I will see you in the next video.